planning, was there anything you've changed or shifted or stopped doing that really wasn't working, or a roadblock you came into?
Definitely one thing that we've tried to step away from is just being super webinar lunch and learn focused. I think over the last couple of years, and some of the feedback that we've gotten from staff is that there is just such a Zoom fatigue that people are facing. Employees feel like they don't have enough time in their day. It's another way for them to just be in front of their computer, and everything that I try to promote is like, if you have free time, get away from your desk, like step away from your computer, go outside. So just having webinars and lunch and learns and just like super content heavy sessions, kind of just it goes against kind of the message that I'm promoting. So I have tried to just move away from webinars and live sessions. And when I am planning events or activities, I've shortened them. So they're maybe like 15 to 30 minutes, and they're more action based. So as part of the mental health awareness programming, there was one session where it was just a 30-minute lunchtime walk, and I put this on my LinkedIn too, just like a picture of it. But we came into the meeting, and then I just had a PowerPoint slide up that said, this is not your average meeting. Go outside, step away from your desk. So it was like time dedicated on their calendars where they all felt like they had that permission to join and participate. But I was like, go, like leave and go, get away from your computer, go outside, take a walk, get some fresh air, just do something for yourself during this time. And then when you come back, just drop in the chat how you felt or what you did. And the response of that, just such a silly initiative, was overwhelming. They were like, thank you so much for this time. I feel so good and refreshed, and I got time with my dog, and I saw birds, and just hearing nature. And that was like, wow, like you guys can do this on your own. Like you can schedule time during your day. But I feel like most people don't do that. So just having that kind of dedicated time was so impactful. So just, yeah, moving away from those live sessions where we're talking about how exercise can impact your mental health, and instead just going out and doing it and living it, and then kind of reaping the benefits right then and there, instead of learning about it. So that was one shift that I think we're going to continue to move towards in the next couple of years for sure.
I would build off of Alicia's kind of topic of social connectedness. And I would say that's been a strong focus for me in my programming planning over the last couple of years. There's no secret that, we know now that social isolation is almost as harmful, if not more, than cigarette smoking and tobacco use. So that hit me very hard at the tail end of the pandemic. And I knew that we needed to, again, similar to you, Alicia, get people away from their computers. I still have to offer that because now we have a wider reach of people that we never had before when we did only do in-person programming. So now it's that healthy balance of both, but being creative with it. So doing leader-led walks during National Employee Health and Fitness Day. We just launched an internal recreation program this fall. And so we're creating more social connected opportunities that aren't just based around physical activity, but common interests, such as clubs and social events. So that's been really helpful for us. I would also add that one other, if you're a wellness professional watching this, if you are not in tune with your community needs, I encourage you to reach out to your local health department, any other coalitions that exist, and take the step and become a member. I'm a part of too many groups in our Sheboygan County, which is where our headquarters are, but two of which are specific to youth mental health, and then a mental health coalition for the county. And I've made it my goal to try to take a lot of the community resources and communicate those in my newsletter, our internal social media page, because people don't always feel comfortable participating in company-sponsored mental health events. And we have to recognize that and meet people where they're at. So if there are community-free resources happening, which most likely there are in your area, then lift those up, right? Be a community partner, help them. They will then come help you. And it just becomes this beautiful organic partnership with all of the community resources that you have access to.
Great tip.
Yeah, I absolutely agree, Erin. I think, boy, that social connection piece can just take place for people in so many different ways. And we do know the research is telling us that people are feeling more isolated. The virtual worlds that we now have to live in are causing more loneliness for people. So just all of us being so conscious of what do people really need? What do they really want? And just even aiding them and knowing that there's different ways to connect with people in different venues, whether that be in the community or in your own work team and those types of things. The other thing that came to mind for me, something that we really stopped doing and something that also our employer partners, they still exist in some places, but more and more are shifting away from those health risk assessments. We don't see the data does not show us that those really are motivating, having people know their cholesterol and BMI and things. Certainly that's a component of health and well-being, but it isn't motivating. And it causes shame in individuals to be, put into that. And people feel like they have to starve themselves before they go in for health risk assessments and things like that. Well, that's a mental angst that people just don't need in today's world. So we've actually stepped more into recommending wellness certificates where people are just getting their age appropriate screenings, making sure that they're connecting with their providers just to keep up on their own health and well-being, deal with any chronic diseases that they may have. And I think that's a much gentler, softer approach that keeps that human being at the center of what they really need in terms of where healthcare can begin, and then hopefully is less stressful for them on the end as well.
That is amazing insight, Linda. I think Jessica and I spent the 15 minutes before this call wondering and talking about HRAs and biometrics and where do they play. The trend report indicated that 65% of the respondents were currently still doing biometrics. It was maybe the fourth from bottom of all the things offered. I mean, on-site was below that. Fitness and gym reimbursement was even below that. But yeah, if you guys have any, amongst the two wellness coordinators here, are you still doing them, still finding value? What are your thoughts?
Yeah, so that is the question of the hour, right? Along with GLP-1s, let's talk about prevention. Yeah, so we did offer them this year, this program year. However, my goal is to move away from them. Right now, they're offered as more of a supplemental free benefit because in 2023, we strongly shifted our incentive design to preventive annual exams. That was something I felt very strongly about with coming off the pandemic, people not going to their doctor. I had a personal experience of going to my first primary care appointment after the pandemic, and I had 2 family members that passed from different chronic conditions that my family history had to be updated, therefore changed the trajectory of the types of prevention I needed and the frequency. And so that was a catalyst for me to say, we need to change our design, and people aren't going to love it. We are going to force the hand a little bit to get people into their doctor, and we allow all different kinds of preventive screenings to be completed. But it's not the biometrics or the health screening. It's not just the blood work. You need to go in and have a face-to-face conversation with people. Now, we're also exploring next year looking at some virtual options, which again is not the golden ticket, but we're trying to consistently meet people where they're at. And if they're having a conversation with a practitioner and they're asking the right questions and getting that information, that is very important to us. So I'm fully on board with prevention. We're actually doing a sweepstakes right now called Prevention is Power. So prevention is everywhere here at Kohler.
Yeah, and just the data shows us we actually even have data supporting now it saves our healthcare system money by getting, it saves us money, it saves the patient money. So it's really win-win by getting people in early and doing those preventative screenings. We all know probably someone that has been affected by cancer, and that becomes really costly in a lot of different dimensions of well-being. So if we can prevent that, that's ideal. That's ideal. So in our department, we talk about saving lives before they know they need saving. It's all about prevention. And so what can we do to get those people into those provider offices, having those conversations, and then letting the provider and the patient decide what's appropriate for me? Where do I feel okay, maybe getting my cholesterol checked, really just having that personalized healthcare that's so important for everyone.
I think sometimes we forget too about the other intangibles that happen during those appointments from an SDOH standpoint. So you get questions around your safety. Do you feel safe in your home? Do you have access to nutrition, healthy foods? And are you, just those types of questions. Mental health, that comes up now. Very strong conversation with my provider. And at the time, I wasn't doing great. And so it was that conversation. Do you have access to the resources that you need? And those are things that we don't always talk about within the preventive screenings. And I can do a better job of that. I'm just having this aha moment now. So I think those are things that we need to encourage as well for people, because they don't always stand out when we promote preventive screenings.
Absolutely. Yeah. That's such a priority for our healthcare system as well, that patients come in and they fill out questionnaires, and that's exactly what gets flagged for an individual. So we can provide and share potential resource to help with that, because we know that those social determinant of health factors are absolutely affecting people's health down the line. So if we can get really upstream and start to prevent some of that and get people the resources they need earlier, that's going to help everyone be healthier, and it's going to infect entire populations if it's done and carried out effectively.
You mentioned social emotional connections. You mentioned preventative exams. When we're looking at the trend report for initiatives, the top initiative is the activity challenges. So getting people together to do things together. And the second is preventative exams. So I think it's in alignment with what we're seeing from our population's needs. And it's translating to actual initiatives within the programs, right? Of like, people need connection, and we need that more in-depth conversations with healthcare providers and those connections, and establish with a provider versus an on-site 15-minute biometric screening that's going to give you just a snippet. So everything you're saying is really cool, that it's aligned in the trend report, and we're hearing that across the board.
Yeah, the only thing I wanted to also kind of make note of as far as preventative care, one thing that we just did in June, which was like the first time we've ever done it. We always focus on preventative care for June, but we actually brought in a dermatologist just because we've never talked about skin cancer and just skin health awareness. So we brought in a dermatologist from Optima Dermatology. It wasn't necessarily to just promote Optima and getting patients in their door, but really just to have a dermatologist come in, talk about skin checks. What does that look like? Because a lot of people put that off because it's a little scary, they don't know exactly what to expect from those appointments. So she just talked about, this is what happens during an exam. I do this 100 times a week, like totally normal, like head to toe, just kind of went through what that visit would look like. And then we had a 15-minute Q&A session at the end. And I had probably 15 employees after that session say, I just scheduled my first appointment for a dermatologist. Never would have thought about doing that. It's just been on like the to-do list, or, you put it off until you're maybe in your 40s or 50s, but it was just something that just kind of bringing the education of the importance of it. Unfortunately, it was like right when summer started, so we didn't want to like scare people for summer, but also just to bring that education that it is so important to, not just think about your traditional annual exams, your dental exams, but really bringing in dermatology and nutrition as well. So just working with a dietitian, we've kind of incorporated those in with our preventative care kind of education.